Okay, good evening, everybody. This is Ursula DeBerry. It's an honor and a privilege for the invitation for Julia Schreiber to be here from the Maryland Department of Aging. The discussion today is about Medicare and Medicaid and what we need to know as an update. I hope that you find this information beneficial and you can share this with others. Julia, would you mind taking over and introducing yourself and explaining, and then we will go ahead and proceed with your presentation. Thank you.
Thank you, Ursula. And I'm happy to be here. My name is Julia Schreiber. I'm with the Maryland Department of Aging. And today we are going to talk about Medicare and Medicaid and also how they work together. For those of you who aren't familiar, the Maryland Department of Aging has a few different roles, and I put them on the screen here. One of our primary roles is to modernize Maryland's aging infrastructure through cross-sector collaboration. We assess programs and develop updated policies and legislation, improve pathways to employment, planning, saving, and services. We protect the rights of older adults, and we reframe the aging narrative. We do this by partnering with 19 area agencies on aging throughout the state. So these are the local offices that are actually delivering the programs and services that the Maryland Department of Aging oversees. One of those programs, which is the program that I manage, is the State Health Insurance Assistance Program. Are also known as SHIP. We have trained counselors that provide assistance for people with Medicare, their families, and caregivers. All of the counseling and guidance is free, unbiased, and confidential. And there are three main areas that we help with. That's navigating Medicare and maximizing benefits, applying for programs that make Medicare more affordable, and preventing, detecting, and reporting fraud, errors, and abuse. Now let's get into talking a little bit about Medicare and Medicaid. So just to start off, this is a really quick overview of what the difference is between the two. Medicare is health insurance for people who are 65 and older or have certain disabilities, whereas Medicaid is health insurance for people with limited income. And you can have both. Medicare is funded by the federal government, whereas Medicaid is jointly funded by both state and federal governments. And then Medicare is actually administered by the federal government, whereas Medicaid is administered at the state level. And oftentimes, people sometimes aren't sure which one they have. And one way that you can tell is by looking at your health insurance card. Medicare is red, white, and blue, and Medicaid is this red and white card. Now let's talk a little bit about Medicare. So who is eligible for Medicare? It is based on age or disability, residency, and citizenship. So as I mentioned, it's Medicare is health insurance for anyone that is 65 or older, or you can be under 65 and be eligible for Medicare. Typically, if you've been receiving Social Security disability insurance for at least 2 years, or if you have end-stage renal disease. You have to be a U.S. resident, and then you have to either be a U.S. citizen or lawfully admitted for permanent residence, and have been residing in the United States for 5 years prior to applying for Medicare. When enrolling in Medicare, there are three main buckets or categories of enrollment periods. There's the initial enrollment period. This is when you're signing up, once you're first eligible for Medicare. So you're first signing up for Medicare. Then there are annual election periods. So this is making changes or switching what coverage you have. And then there are special enrollment periods, and that allow you to sign up or make changes outside of the dedicated periods under certain circumstances. For the initial enrollment period, this is the 7-month period around your 65th birthday. So it's the 3 months leading up to your 65th birthday month, that the month of your birthday, and then the 3 months after. At any point, you can sign up for Medicare during that period, and we often advise that you sign up as soon as possible. And we'll talk a little bit about late enrollment penalties down the line. But if you enroll during those first 3 months, Medicare will start the first of your birthday month and continue forward. Whereas if you enroll your birthday month or any of the months after, those 3 months after, it will start the following month. And to enroll in Medicare, you sign up through the Social Security Administration. Annual election periods are a little bit different. This is when you already have Medicare. And so there's the Medicare open enrollment period, which is from October 15th through December 7th every year. Again, those are for anyone who already has Medicare. And this is a period to switch between original Medicare and Medicare Advantage, or change your Medicare Advantage plan, or change your prescription drug coverage. There's another dedicated period from January 1st to March 31st. And this is actually just for people who have Medicare Advantage, which we'll go into a little bit more shortly. And during this period, you can switch back to original Medicare or change your Medicare Advantage plan. You do this through the private plans, or a really great resource is going to medicare.gov/plan-compare. And they compile all of the plans, and you can filter based on your particular situation and see which plan is best for you. Special enrollment periods are when there are certain events that allow exceptions to the initial enrollment period, and then these annual election periods. So oftentimes, if someone is still working at 65 or past 65, there may be a situation where they have insurance through their employer and they don't need to sign up for Medicare until they retire. In this situation, there would be a period where you would be able to enroll in Medicare once you do retire without penalty. Or if you had Medicaid and then you no longer qualify for Medicaid, there's again another period that allows you to make changes or enroll at a different time.
Bem, bem.
It's really important to sign up once you are first eligible because there are late enrollment penalties. So you could have to pay more. The late enrollment penalties are added to the monthly premium. So that monthly amount that you pay for to have health insurance, they are not a one-time late fee, and they're usually a monthly lifetime penalty. And these can go up the longer you wait. So for hospital insurance, Part A, and for medical insurance, Part B, it's 10% every year. And for Part D, which is prescription drug coverage, it goes up 1% every month that you don't have coverage. And there are some exceptions to this. So if you have other coverage that's similar in value to Medicare, you may qualify for one of those special enrollment periods, so there wouldn't be any late enrollment penalties. Or if you're eligible for Medicaid or some other types of programs, financial assistance programs, that can eliminate any late enrollment penalties. So Medicare coverage options. When someone first becomes eligible for Medicare and is enrolling, one of the first key decisions that they make is whether to enroll in Original Medicare or Medicare Advantage. Original Medicare is hospital insurance and medical insurance. So maybe you've heard of it as Part A and Part B. Medicare Advantage is actually a Medicare approved plan from a private company. So Original Medicare is provided by the federal government, where Medicare Advantage is a private plan. With the Original Medicare, you can add a separate Part D or Medicare drug plan to help with your prescriptions. With Medicare Advantage, these plans often bundle all of those parts together. So you get hospital insurance, medical insurance, and most often also prescription drug coverage in one plan. With Original Medicare, you can use any doctor, hospital, or lab that takes Medicare anywhere in the United States. With Medicare Advantage, you're often required to use doctors, hospitals, and labs that are within a plan-specific network. And then you may also have to get referrals and/or prior authorizations to see specialists or to get certain procedures. With the Original Medicare, you have the option to add supplemental coverage that helps pay the out-of-pocket costs. Whereas Medicare Advantage may offer some extra benefits that Original Medicare doesn't cover, like vision, hearing, and dental services. Now, I've thrown out a lot of letters, a lot of the parts. So let's talk about what Medicare covers in all of those different parts. Part A is hospital insurance. Part B is medical insurance. Part C is that Medicare Advantage, where it bundles together all of the parts. And then Part D is drug coverage. We'll talk about Medigap in a moment. Now, there's a lot of information here, but these are just some examples of what each of these parts covers. So hospital insurance, that's going to be inpatient care in a hospital. It can also be skilled nursing facility care from a skilled nursing facility, hospice care, or home health care after a hospitalization. And oftentimes, there's also a misconception that Medicare is entirely free. And that's because if you have paid into Medicare for 40 quarters, so if you've worked and paid into Medicare for about 10 years, then you get premium-free Part A. Now, there are still some co-insurance and co-pays, but you don't have to pay a premium for it. Part B is medical insurance. And this is services from doctors and other healthcare providers, outpatient care, also some home health care, durable medical equipment, and then preventive services. And so these two parts are what make up original Medicare. Part C, Medicare Advantage, we talked about a moment ago. But so Part C has to include everything that is covered under original Medicare. So at a minimum, these Medicare Advantage plans have to include hospital insurance and medical insurance. As I mentioned, they also often include drug coverage, although if you're looking at a Medicare Advantage plan, you want to double check to make sure that it does include drug coverage because not all of them do. And then they may include some additional benefits related to dental, vision, and or hearing care. Part D, or drug coverage, are also provided through private plans. So this is if you have original Medicare, you would also buy a Part D drug plan. And then you would review it each year during that Medicare open enrollment period from October 15th through December 7th. To make these plans can change, so it's good to make sure that it still meets your needs, or to see if there might be a more cost-effective plan. And so this covers prescription drugs, but it also includes coverage for some recommended shots and vaccines. Then there's Medigap. This is these or Medicare supplement plans. This is optional extra insurance from a private company, and it helps pay the share of costs for original Medicare. So some of the out-of-pocket costs that Medicare doesn't, that's your share of the medical expenses, like co-payments, co-insurance, and deductibles. Medigap can only go with original Medicare. You cannot have a Medigap plan and also have a Medicare Advantage plan. And if you do decide to go with original Medicare and a Medigap plan, it's very important to sign up to enroll in a Medigap plan when you are first eligible, because you have a guaranteed issue right. So they have to sell you a plan without valuing it or charging you based on pre-existing conditions. So that was a lot of information about the parts. So just to summarize, original Medicare, you have Part A and Part B, and you can add a standalone drug plan, which is Part D, and or you can add a Medigap plan, so supplemental coverage to help with those out-of-pocket costs. Then there's Medicare Advantage, which bundles all of them together. So it always has covered Part A coverage. It always has Part B coverage. In most plans include drug coverage and some extra benefits. Medicare also works with other types of insurance. So you can have Medicare and job-based insurance or retiree insurance, federal employee health benefits, or TRICARE, which is for active duty military and their families. So you can have both. Medicare also works with Medicaid. So you can have both Medicare and Medicaid. And in fact, 1 in 5 people with Medicare are dually enrolled in Medicaid. So now let's talk a little bit about Medicaid, which in Maryland, it is referred to as medical assistance. It's something that it's very important to note that Medicaid eligibility criteria and coverage change once you become eligible for Medicare. So Medicaid looks different once you are eligible for Medicare. And that's not just if you are actually enrolled in Medicare, it's once you're eligible. That's because you have to have, once you are eligible for Medicare, you have to have Medicare in order to have Medicaid. So before Medicare, the coverage is typically through what's called a health choice plan, or through a managed care organization. So these are through private companies. They're plans that are specific Medicaid plans. After Medicare, or once you're eligible for Medicare, Medicare becomes the main insurance, and Medicaid becomes a wraparound. So Medicaid typically helps cover, pay for things that Medicare doesn't, and may also cover additional benefits. In terms of eligibility, before Medicare, it's typically solely based on income, whereas once you're eligible for Medicare, it's based on income and assets. So, for instance, your savings. So your income and assets have to be within a certain amount in order to receive Medicaid benefits. And in fact, the income limits are much lower once you are eligible for Medicare than before. Something else to note that's new for those that have Medicaid but not Medicare, adults without children, there are work requirements, and their eligibility is redetermined now every 6 months as opposed to every 12 months. There are different ways to qualify for Medicaid, and each of the pathways offers different benefits and coverage. One moment. So there's full benefit Medicaid. This helps pay Medicare premiums, deductibles, and copays, and offers some some service coverage for services that Medicare does not cover. So, and just to level set a little bit, because I've been using these terms a lot, premiums are the monthly amount that you pay for your health insurance, regardless if you use the health insurance. Deductibles are the amount that you have to pay before the health insurance starts helping with the expenses. Copays are a set amount that you will pay each time you receive a service or a prescription. And then coinsurance is like like copays, but it's a little bit different. Instead of a set amount, it's a percentage that you pay when you receive a service or item. So full Medicaid benefits, you're getting the whole package. You're getting help to pay for things that Medicare doesn't pay for, and you're getting some additional coverage. The income limits and asset limits are very low for this. It is $350 a month and $20 for your income and $2,500 for your assets. For those that don't qualify based on those eligibility criteria for full Medicaid benefits, there are what are called Medicare savings programs. These are typically referred to as partial benefits or partial Medicaid, and they provide limited help with Medicare costs only. We'll go into that more shortly. Then there's long-term care Medicaid. These are special Medicaid programs that provide coverage for individuals with higher medical need who require more comprehensive either care in-home or nursing home care. And you've maybe heard that there's nursing home Medicaid, and then there are also various Medicaid waiver programs. And you could be eligible for those based on different medical needs. There's also a pathway to qualifying for full Medicaid benefits, even if your income and assets are too high. And this is called Medicaid spend down. This is where you can deduct your medical bills from your income or asset amount. So if you have very high medical expenses, you can count those. Those can essentially reduce your income and assets, and you can potentially qualify for full Medicaid benefits. Some of the bills that can be used are hospital bills, physician bills, prescription medications, durable medical equipment, over-the-counter drugs even, and it can be paid or unpaid medical bills. For this, there's a 6-month consideration period. So if you qualify, you get the benefits for 6 months, but then they'll make another determination after those 6 months to see if you're still eligible based on your medical expenses. In terms of those Medicare savings programs or those the partial Medicaid, there are actually a couple of tiers within these programs. So if your income, the income and assets change every year, but this year in 2026, if you're an individual that makes $1,350 a month and has just under $10,000 saved, then you would qualify for a program called the Qualified Medicare Beneficiary. or QMB. And this doesn't provide extra health insurance, but it will cover the Part B premium and any out-of-pocket costs. So it can be very helpful. Medicare can be expensive, and so it covers the majority of those out-of-pocket costs. And if you do happen to have to pay a Part A premium, it'll cover that as well. There's a little bit higher income limit for the specified low income beneficiary, or SLMB program. That's $1,816 a month, $1,816 a month. If you make less than that, then this program will pay your Part B premium. And in 2026, the Part B premium is $202.90. So every month it'll cover that amount. In addition to those benefits, anyone that's enrolled in Medicare Savings Program also receives extra help with their prescription drug costs. And that's a segue into some additional programs that help with drug costs. So extra help are also referred to as the Part D low income subsidy. Helps with Part D premiums, deductibles, coinsurance, and other costs. So that means that the extra help program will actually cover your Part D premium up to a certain amount. That amount changes every year and it's different by state, but it's typically around $40. So if your prescription drug plan is $40 or less, it will actually be zero with the extra help program. If it's more, you pay the difference. And then the medications are standard rate and are much lower. The income and the eligibility rules for extra help, their income, the income, excuse me. You must qualify for extra help based on income and assets. Those limits are actually a little bit higher than the Medicare savings programs that we were just talking about. So it is also possible to just qualify for extra help. So even if you don't qualify for a Medicare savings program, you may qualify for this extra help program. Additionally, for those that may not qualify for extra help, is the Senior Prescription Drug Assistance Program. This is offered through the state of Maryland, and while it doesn't offer as much help as extra help does, but it does cover. It provides a subsidy towards your Part D premium. So then actually there's a little typo here. It used to be $75, up to $75 a month. Now it's actually up to $100 a month. So as long as your plan is $100 or less, and you qualify for this Senior Prescription Drug Assistance Program, your plan will actually be $0 a month. If it's over, then it'll pay the $100 and you pay the difference. And this program is specifically for those who do not qualify for extra help. And the income limits are about double that of extra help. So they're a good bit higher and they don't have asset limits. So how much you have saved does not apply. Some additional programs that in particular, Good Pill, this is not specific to Medicare, We're very fortunate to have this in Maryland. It's a nonprofit home delivery pharmacy. They offer a wide range of medications at a very low cost, typically about $6 for a 90-day supply. And so eligibility is just based on self-attestation of need. So if you feel that you can't afford you're having trouble affording your prescription medications, and they have the medication available, you can register, and they'll provide that medication for you, even if it's already at another the prescription's at another pharmacy. They'll work with you and the pharmacy to get it switched over to them. There's also the Maryland AIDS Drug Assistance Program, which helps with medications and medication copays and deductibles for those that have HIV. Just to highlight a little bit about Medicare and Medicaid and their coverage for hearing related needs. For Medicare, coverage is actually very, very limited. It's written in statute that hearing services and items cannot be covered through Medicare. And that's also the case for vision services and items as well. If a doctor prescribes it, Medicare will cover diagnostic hearing and balance exams. And recently, there's coverage was expanded for cochlear implants. That said, there's a little bit more flexibility with the Medicare Advantage plans. So they do offer some of those additional benefits, but they vary widely by plan. So they may offer some diagnostic hearing exams, hearing aid evaluations and fittings, the actual hearing aids, and then repairs and supplies. Oftentimes this is typically an allowance towards the hearing aids. And then if you're dual eligible, so you have both Medicare and Medicaid, that's where there's the most comprehensive coverage. So Medicare may not cover it, but Medicaid will cover medically necessary hearing aids and cochlear implants, as well as repair batteries and supplies, and the evaluations and fittings. That's all the information that I have to cover today. I want to highlight that we have trained Medicare counselors all throughout the state. So if you would ever like to speak with the counselor, you can go to aging.maryland.gov/ship and find the number to your local office. They can help with picking a new plan, deciding whether to enroll in Original Medicare or Medicare Advantage, seeing if you may qualify for a Medicare savings program or extra help, and actually helping with those applications, or if you're trying to understand what does your plan cover, or you're having a billing issue, the SHIP counselors are a place that you can turn. At this time, I would be happy to answer any questions that you may have. I'm also going to add the phone number that you can call. And this is the Maryland Department of Aging's phone number. And if you press 1, uh, um, if you can call through Maryland Relay and they'll call Maryland Department of Aging, and that number can automatically route you to your local office.
Alrighty, does anybody have any questions for Julie? Alrighty, it seems like there are no questions.